You want to go ahead, Tom, to go start that?
This is real straightforward. This just says what's good for the goose is good for the gander. If we're going to create a government-run plan, then let's put us in it. Let's put the members of Congress in it. We like what we got. We're telling the American people we're going to try to give them what we got. Then let's demonstrate leadership by requiring that every member of Congress has to get their health insurance from the government-run plan.
Would my colleague yield?
I'd be happy to.
I accept the amendment.
It's well done. Thank you.
Mr. Chairman, let me note as voting no.
I'll ask unanimous consent that the amendment be agreed to.
Let me object.
Who's objecting?
I'm objecting. The so-called government-run plan says in its second sentence that no person is required to participate in the plan. No Americans required to, no penalty be assessed against anyone who doesn't participate in the plan. I don't know why we shouldn't have what's good for the goose be good for the gander. Why shouldn't we qualify? We didn't give up our citizenship to become members of Congress. I don't see why we should require ourselves to participate in the plan, which we're specifically saying nobody else needs to participate in.
Because we're in leadership positions. And if it's not good enough for us, it isn't good enough for the rest of America.
Well, if the rest of America doesn't want to participate, then we are protecting their right not to participate. And we should protect the right of every American not to participate, including ourselves.
Well, I would just fundamentally disagree with it. We're moving in a direction that's going to put we're already at 60% of health care under the control of the government in this country. We're going to move to 70% or 80%, and we're going to accept ourselves from being a part of that. And so we're going to, all this amendment is saying we should take the lead and say, we will sacrifice. We will give up our right to choose. We will put ourselves as a demonstration of our faith in how good this is going to be. We're going to put us into that plan.
Now, why should we be giving up the right to choose, which we are explicitly providing for every American?
To demonstrate our confidence in how wonderful this is going to work.
You have
I accept the endorsement of the senator from Oklahoma, the public option. That's a very...
I mean, if the idea is...
I think you might not have caught my tinge of sarcasm.
If the idea is...
It's the editorial tinge in that, I think.
If the idea is that the government plan ought to be available for members of Congress and staff and other federal workers to participate in, if they choose to, then I would agree with that, and I would support that amendment. But I think the right to choose whether you buy a private plan or you buy this community health insurance option or buy your coverage through that, this bill goes to great lengths to ensure that choice is there for everybody. And it ought to be there for ourselves, our staff, every American.
Well, every American is subsidizing our insurance to the tune of $12,000 a year. Everybody's sitting at this table. And what we ought to demonstrate to them is that we have enough confidence in this system that we're willing to expose ourselves to this system by taking the lead and giving up a right to choose.
Well, we're not asking anyone to give up a right to choose.
Oh, yes,
we are doing just the opposite. We are giving people an additional choice that they can make or they can reject.
Ultimately, you will have everyone in this plan. Ultimately, everyone will be in this plan.
Well, you're the only one who believes that.
I'm not the only one. The
CBO doesn't believe that.
Well, the CBO has been wrong on every mandatory and labeled program that is ever quoted about the costs and the outcomes. So we can rely on CBO, just like we can rely on CBO, much to the deference of what was given yesterday. They're saying if employers who do not offer insurance are required to pay, employees' wages and other forms of compensation will generally decline by the amount of fee that was otherwise paid. You're going to lose jobs. That's what CBO said today. In particular, pay or play provision could reduce the hiring of low-wage workers whose wages could not fall by the full cost of health insurance or substantial pay or pay, so you're going to move more. One program that creates work disincentives for the recipients is Medicaid. That program is structured so that eligibility for benefits is completely eliminated at specified income for most eligibility categories. In other words, there's
what does this have to do with your amendment?
It has to do with the fact that I know where we're going. You assume we're not going there, but we've never seen a government program not grow in health care. And if, in fact, the government plan is competitive for people outside of the plan, they're going to move to the plan. Except it'll never be financially viable because the secretary is going to set the rates. And the only way you're going to have a plan that's going to be viable and have enough people in it is have a lower rate. And then when the cost, just like the Maine public plan, the Maine has a public plan right now, and they've got 10,000 people in it. They've actually increased the number of people uninsured that have moved towards it. It is a failure. It is a failure.
Well, this may turn out to be a failure too. And I understand the Senator from Oklahoma doesn't like the idea of a public plan, but the idea that we would provide that as an option for all Americans, except members of Congress and their staffs who would be required to be in it, I think is just an illogical way to proceed, and I would oppose it.
All those in favor of the Coburn Amendment say aye.
Aye.
Aye. Those opposed, no.
Oh,
I'd ask for a recorded vote.
Clerk, call the roll. Aye. Aye. No, by proxy.
Aye.
no,
No.
No by proxy. No by proxy.
Senator Sanders? Senator Brown?
No by proxy.
Senator Casey? Senator Hagan? Senator Merkley? Senator Whitehouse?
No by proxy.
Senator Enzi? Senator Gray? I'm sorry? Senator Alexander? Senator Burr? Senator Isaacson? Senator McCain? Senator Hatch? Senator Murkowski? Senator Coburn? Senator Roberts? Chairman Kennedy?
Aye by proxy. By proxy.